If you're a man over 50, you need to stop what you're doing and listen to this. There is a daily habit, something you might be doing in the privacy of your own home, that has a direct and powerful impact on your prostate. And no, we're not talking about diet or exercise. It's something far more intimate, an act that has been shrouded in myth and misinformation for decades. The truth is, the frequency with which you do this could be the difference between a healthy prostate and developing serious problems that can shatter your quality of life. What most men don't know is that there is a sweet spot, a delicate balance between what is healthy and what is excessive. And ignoring this secret could be silently putting you at risk. Keep watching, because the truth behind this will shock you. I'm Dr. Claire Foster, a urologist specializing in men's health for over 15 years. Throughout my career, I've helped thousands of patients navigate the complexities of aging. And I've found that conventional medicine often ignores the powerful connection between our daily habits and our long-term health. Today, we're going to break one of the biggest taboos and reveal what the science truly says about daily masturbation and what it means for your prostate. Many men believe that any urinary issues or pelvic discomfort are just a normal part of getting older. Let me be clear, that is a dangerous myth. Ignoring the signs your body is sending, you can lead to devastating consequences. We're talking about chronic prostatitis, a painful inflammation that can make the simple act of sitting down feel like torture. We're talking about benign prostatic hyperplasia, or BPH. The enlargement of the prostate that causes that weak stream and those endless trips to the bathroom at night, robbing you of your sleep and your energy. And in the worst-case scenario, we're talking about an increased risk for prostate cancer, one of the most common cancers among men. The truth is, your body is crying out for attention. The good news is that by understanding the science, you can take control. As we get ready for the big reveal, tell me in the comments which city you're watching from. I love to see how far our health community reaches. Now, let's get straight to it. I've broken down this crucial information into 3 secret truths every man needs to know about ejaculation frequency and prostate health. The first truth is something many find counterintuitive, and that's precisely where its power lies. Frequent ejaculation can be a protective shield for your prostate. Let me tell you about Robert, a 68-year-old retired engineer. He came to my office worried about his family's history of prostate cancer. "Dr. Foster," he said, "I feel like I'm sitting on a time bomb. Is there anything I can do besides just wait and see?" Robert lived a relatively healthy lifestyle, but he was living in constant fear. When I asked about his sexual habits, he admitted that, after his wife passed away, his sexual activity was virtually zero. He believed saving his energy was beneficial. That's when I revealed to him what large-scale studies were showing. Initially skeptical, he decided to follow my advice. 6 months later, at a routine checkup, his prostate's inflammatory markers had improved. "I feel more relaxed and, honestly, less worried," he told me. It's like I was given permission to take care of myself in a way I never considered to be health. The science behind this is fascinating and actually quite simple. Think of your prostate as a filter. Over time, toxins and potentially cancer-causing substances can accumulate in the prostatic fluid. Ejaculation acts as a flushing mechanism, helping to clear out these harmful substances. Major studies, including one from Harvard University that followed nearly 32,000 men, found something astounding. Men who ejaculated 21 or more times a month had up to a 31% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times a month. It's basically as if you're performing regular maintenance on an important engine, preventing the buildup of gunk that could cause future breakdowns. The science is clear on this. Stagnation of prostatic fluid is not your friend. The practical application protocol here isn't about hitting a magic number but about consistency. The goal is to establish a routine of regular ejaculation, whether with a partner or alone. The science points to frequency, not necessarily the method. For many men, masturbation is the most accessible and consistent way to achieve this protective benefit. This isn't about excess, but about keeping the system flowing. And if you found that wrist feeling, wait until you hear about our second secret, as it addresses the other side of the coin, the hidden danger that many men ignore. The second truth is, Excess can turn the medicine into poison, leading to congestive prostatitis. I want you to meet Charles, a 62-year-old salesman who always prided himself on his high libido. He would masturbate multiple times a day, believing it was a sign of virility. I thought the more of the better, he confided in me, his face twisted in pain. Charles came to my office with a deep, constant pelvic ache and discomfort when he urinated. He was anxious, irritable, and his intimate life with his wife had vanished. He was diagnosed with non-bacterial chronic prostatitis, a condition that can be linked to pelvic muscle issues and nerve irritation. His skepticism was palpable when I suggested the cause might be excessive frequency. "How can something that's supposed to be good for me be hurting me?" he asked. "Here's what's happening on a physiological level. Think of your prostate as a small factory that is constantly producing seminal fluid. Continuous sexual stimulation without enough time for full ejaculation or recovery can lead to a traffic jam. Blood rushes to the pelvic region, and the prostate becomes congested with fluids. It's like turning on a faucet into a tank that's already full. This constant pressure and stagnation can lead to chronic inflammation. The symptoms are exactly what Charles described: pain, pressure in the groin, and urinary problems. It isn't an infection, but a mechanical condition caused by overload. What worries you most today? Type 1 in the comments if it's cancer risk, or 2 if it's daily discomfort and urinary issues. Your answer helps me create future content. The application protocol here is about self-awareness and moderation. If you practice daily masturbation, pay close attention to your body's signals. Are you feeling pain, pressure, or discomfort after the act? That is a warning sign. It is crucial to allow your body time to recover. Balance is the key. Masturbation is not inherently harmful, but compulsion and excess can be. The goal is well-being, not the pursuit of a frequency record. Now, if you're starting to see the full picture, our third truth will connect everything and reveal how this daily habit impacts your mental and hormonal health, which in turn affects your prostate. The third and final truth is, compulsive daily masturbation can dysregulate your hormones and increase stress, fueling inflammation. I had a patient, David, a 65-year-old university professor who used masturbation as an escape valve for work-related stress. It became a vicious cycle. I'd feel anxious, so I'd do it to relax. But then I'd feel guilty and even more anxious, and the cycle would start over, he explained. David didn't realize this compulsion was physically affecting his body. His levels of cortisol, the stress hormone, were chronically elevated, and he felt perpetually fatigued. This internal hormonal storm was contributing to low-grade inflammation throughout his body, including his prostate. The science here shows us a deep mind-body connection. Compulsive or excessive masturbation can lead to dopamine peaks and crashes, which can affect mood and increase anxiety. More importantly, chronic stress, whether from life or from a cycle of compulsion and guilt, tells the body to produce more cortisol. Elevated cortisol levels are directly linked to systemic inflammation. Think of stress as pouring gasoline on a small fire. For the prostate, which is already susceptible to inflammation with age, this stressful hormonal environment is a danger. Chronic inflammation is a known risk factor for the development of both BPH and prostate cancer. The practical protocol here is to look at the why behind the habit. If you masturbate every day, ask yourself, is it for genuine pleasure and relaxation, or is it an automatic response to stress, boredom, or anxiety? If it's the latter, it's crucial to find healthier coping mechanisms. This could include exercise, meditation, hobbies, or talking to a professional. Lowering your body's overall stress will decrease the inflammatory burden on your prostate. Remember, prostate health does not exist in a vacuum. It is a reflection of your overall health, both physical and mental. So to recap, the 3 secrets to managing your prostate health in relation to this daily habit are: Number 1. Recognize that consistent frequent ejaculation around 21 times per month can act as a protective shield against prostate cancer. Number 2, beware of excess. Compulsive masturbation multiple times a day can lead to painful congestive prostatitis. And number 3, understand the mind-body connection. Using masturbation as a crutch for chronic stress can fuel the inflammation that harms your prostate. Change is possible with consistency and self-awareness. Your body hasn't forgotten how to be healthy. It just needs your command. You have the power to take control of your health, to reclaim your strength, confidence, and vitality. This isn't about getting old, it's about aging powerfully and with dignity. If this information was valuable to you, please hit the like button so YouTube will show it to more men who need it. And don't forget to leave a comment. I personally read as many as I can. Share this video with a friend or family member who you know will benefit, and of course subscribe to the channel so you don't miss any health guides. And one last thing, a personal request. I recorded this video wearing a mask. It was really important for me to know if the sound quality was good and if you could understand me perfectly. Please leave a quick comment about it. Your feedback is crucial for me to keep improving. A big hug, and I'll see you in the next video.